Hello and welcome to day 12. So today we're just going to do an overview of the head, and we're going to talk about the muscles and the bones that are associated with it. So basically your skull, their bones support the structure of the face and the skull. It protects your brain and sensory organs. The muscles allow facial expression, chewing, and speech. It is frequently referenced in medical records. And one thing to note, of course, we just talked about it, but the head includes both skeletal and muscular components. Bones of the head, you have your skull, which is also called cranium. The skull protects the brain, while the facial bones shape the face. So we see next we have facial bones. They're what gives our face shape. If you've ever seen anybody who's been in a traumatic accident and they damage their bones in their face and has to get redone because their face loses the shape. The mandible is the jawbone, and it's the only movable bone of the skull. And the maxilla is the upper jaw. So it's important just to be familiar with these when you do your coding, especially with your procedures, to know which part they're talking about. Muscles of the head, of course, they allow for our facial expressions. Smiling, blinking, frowning. Then we have our chewing muscles. Now, another word for chewing that you'll hear is mastication. So they help with chewing, but not only chewing, but speaking. And you have your temporalis and your masseter. So these are your big muscles of your head. Muscle involvement can be important in trauma, in nerve damage, and jaw disorder. Sorry, I just got tongue-tied. Common medical terminology, cranio, that's a word part. So when you see that, you know that it's referring to the skull. Maxillo is the upper jaw. Mandibulo is the lower jaw. Myo, we talked about this on another day, is muscle. And then something, of course, that you'll commonly see is the term cephalgia, which is headache. Common conditions of the head bones and muscles. So skull fractures can happen, facial fractures. TMJ, which is temporomandibular joint disorder. So that's a big word to say, so that's why we say TMJ. Bruxism, that's another word for teeth grinding. And then there can be facial muscle paralysis. Trauma is a frequent cause of head bone injuries, of course. TMJ, if you don't know what that is, it affects the jaw movement and chewing. A lot of people suffer from that. They clench their teeth at night. We talked about the other term for teeth grinding, which is bruxism, and sometimes that is what leads to TMJ. And then facial paralysis may be related to nerve or muscle damage.